Okay, gain before loss from Pounds and Inches by Dr. Simeons. Okay, patients whose general condition is low owing to excessive previous dieting must eat to capacity for about 1 week before starting treatment, regardless of how much weight they may gain in the process. One cannot keep a patient comfortably on 500 calories unless his normal fat reserves are reasonably well stocked. It is for this reason also that every case, even those that are actually gaining, must eat to capacity of the most fattening food they can get down until they have had the third injection. It is a fundamental mistake to put a patient on 500 calories as soon as the injections are started, as it seems to take about 3 injections before abnormally deposited fat begins to circulate and thus become available. We distinguish between the first 3 injections, which we call non-effective as far as the loss of weight is concerned, and the subsequent injections given while the patient is dieting, which we call effective. The average loss of weight is calculated on the number of effective injections and from the weight reached on the day of the third injection, which may be well above what it was 2 days earlier when the first injection was given. Most patients who have been struggling with diets for years and know how rapidly they gain if they let themselves go are very hard to convince of the absolute necessity of gorging for at least 2 days, and yet this must be insisted upon categorically if the further course of treatment is to run smoothly. Those patients who have to be put on forced feeding for a week before starting the injections usually gain weight rapidly. 4 to 6 pounds in 24 hours is not unusual, but after a day or two this rapid gain generally levels off. In any case, the whole gain is usually lost in the first 48 hours of dieting. It is necessary to proceed in this manner because the gain restocks the depleted normal reserves, whereas the subsequent loss is from the abnormal deposits only. Patients in a satisfactory general condition and those who have not just previously restricted their diet start forced feeding on the day of the first injection. Some patients say that they can no longer overeat because their stomach has shrunk after years of restrictions. While we know that no stomach ever shrinks, we compromise by insisting that they eat frequently of highly concentrated foods such as milk, chocolate, pastries, with whipped cream, sugar, fried meats, particularly pork, eggs and bacon, mayonnaise, bread, with thick butter and jam, etc. The time and trouble spent on pressing this point upon incredulous or reluctant patients is always amply rewarded afterwards by the complete absence of those difficulties which patients who have disregarded these instructions are liable to experience. During the 2 days of forced feeding from the first to the third injection, many patients are surprised that, contrary to their previous experience, they do not gain weight and some even lose. The explanation is that in these cases there is a compensatory flow of urine which drains excessive water from the body. To some extent this seems to be a direct action of HCG, but it may also be due to a higher protein intake, as we know that a protein deficient diet makes the body retain water, and that's underlined. Starting treatment. In menstruating women, the best time to start treatment is immediately after a period. Treatment may also be started later, but it is advisable to have at least 10 days in hand before the onset of the next period. Similarly, the end of a course should never be made to coincide with onset of menstruation. If things should happen to work out that way, it is better to give the last injection 3 days before the expected date of the menses so that a normal diet can be resumed at onset. Alternatively, at least 3 injections should be given after the period, followed by the usual 3 days of dieting. This rule need not be observed in such patients who have reached their normal weight before the end of treatment and are already on a higher caloric diet. Patients who require more than the minimum of 23 injections and who therefore skip 1 day a week in order to postpone immunity to HCG cannot have their third injections on the day before the interval. Thus, if it is decided to skip Sundays, the treatment can be started on any day of the week except Thursdays. Thus, did I just skip Sunday? The treatment can be started Thursdays. Friday, Saturday. Okay. Supposing they start on Thursday, they will have their third injection on Saturday, which is also the day on which they start their 500-calorie diet. They would then base no injection on the second day of dieting. This exposes them to an unnecessary hardship, as without the injection they will feel particularly hungry. Of course, the difficulty can be overcome by exceptionally injecting them on the first Sunday. If this day falls between the first and second or between the second and third injection, we usually prefer to give the patient the extra day of forced feeding, which the majority rapturously enjoy. Okay, I'm going to start a new one. It's called The Diet. It explains what you can have per Simeons protocol. I know you've probably read it over and over, but this is out of his book. So, anyway, for those of you who haven't read Pounds and Inches, you need to read these or listen to them. Thanks. Bye.